I've been experiencing leg pain for quite a while. It was progressively getting worse to the point where I was having trouble walking. Even sitting down, taking weight off my leg, still had the pain. Laying down, I'd get the shooting pain, burning pain. It was disrupting my sleep. So it was getting to the point where it was too much. Something, had to be done. I had seen a doctor in Massachusetts, and I was still experiencing pain. And my son-in-law is a radiologist for a New York hospital group. He actually read my MRI and saw the bulging disc. My son-in-law Alex had actually researched area facilities, and he said that University Orthopedics had a great reputation, and that's when I decided to contact University Orthopedics.
Hello, hey there, how are you?
I'm good, thank you.
Good.
When I first made the appointment and I came to the facility and met Dr. Bask, that's all I needed to know. I felt comfortable with him immediately. He listened to everything I had to say, wanted to make sure we touched all the bases before surgery. We both had the same mindset, so we went through the progression of injections and therapy.
So his particular problem was that he had closure of one of the nerve tunnels on the side of the spine. When I saw his images, I knew it was a bad problem. I always see surgery as a last resort, and so I always try physical therapy, medication, injections, and I tried all of those with him. He went through everything. He went through 2 injections, trying to avoid surgery. But I knew that fortunately there was a good solution for it should he require surgery, which he ultimately did. What's great about the problem he had is that there is a very good minimally invasive option for it. It's something that allows us to take care of the pathology while being minimally disruptive to surrounding muscle and bone and tissue and things like that. And it really allows a very rapid recovery. In his case, he was actually able to go home the same day after surgery, a couple hours after surgery, and immediately he noticed that his horrible leg pain that he had before surgery was gone.
I was totally amazed. I didn't realize that you could have minimally invasive back surgery through 2 incisions, all that work being done through 2 probes. And Dr. Bask is the only one in this area that performs surgery that way. That was an eye-opener. I just couldn't believe that. I knew that my recovery would be even quicker doing it through that method. The surgery went fantastic. I went from 7 months of pain to the day of the surgery. Right after the surgery, I had no leg pain at all. I actually came home that day, which was unbelievable. Within 3 days, I wasn't using the walker, I was walking on my own. It was life-changing.
I think it's a total game changer. I've really tried to shift away from a lot of the open surgeries in my practice. It works, but it's a very long recovery. When there is an option that works just as well, if not better, and the recovery is a lot faster, gets people back to their lives, gets people back to work. Unfortunately, it just isn't that available these days still. It's newer techniques, not everybody's been trained on it. This is all I do, is I specialize in minimally invasive surgery.
When I came home, he actually called me at home. Not his staff, no one else. He personally called me. That made me feel so good because I knew what kind of doctor he was. Not only is he a tremendous surgeon, but he's a caring, compassionate doctor. And that, as a patient, that meant the world to me. I have my life back from going through so much pain on a daily basis to the point where I couldn't even do anything. At Christmas time, that's one of my favorite things. I couldn't even decorate or do things around the house. How quickly after surgery that I was pain-free, it's incredible.
When you're dealing with nerve pain, I think there's really nothing quite like it. If you know people who have had back pain or pinched nerves or nerve pains, there's nothing quite like it. You cannot avoid the pain. It's day, it's night, and it drives you up a wall. Being able to take that pain away very reliably and seeing somebody who went from being absolutely miserable to having no pain whatsoever and getting back to all the activities that he enjoys very quickly, because we use these minimally invasive techniques. And this is why I do what I do. He's a fantastic patient. He's put in all the hard work in terms of his recovery. When you realize that you've made him better and made him permanently better, it's unlike anything else. It's really rewarding seeing him there with his wife, so happy, getting back to the things that he enjoys. It's unbelievable.
Once I'm able to get out and move around, and I'm coming in contact with friends again, I've been telling them, Dr. Bask is tremendous. This is what he did for me. So I've been trying to get that message out to people that there is hope when you have these problems.
For those people who have tried everything and it's failed, there are great options these days to get rid of that pain, and now there are great minimally invasive options that really allow a rapid recovery faster than we've ever seen before.
Dr. Bask, thank you for giving my life back. I can't say enough superlatives. I can't think of enough adjectives, positive adjectives to describe him. He's tremendous.